Today, we'll explore the urinary system disorders, including kidney and bladder conditions and how they impact health and massage therapy considerations. By the end of this session, you'll understand major urinary system disorders, their signs and symptoms, treatment options, and how massage therapy can safely support clients with these conditions. Let's take a closer look at the urinary system and its main components. The kidneys are the starting point. They filter blood and produce urine, which then travels through the ureters. These ureters have a 3-layer structure and connect to the bladder through valves that prevent backflow. The bladder itself also has a similar layered design and is lined with protective mucus to guard against infection. Finally, urine exits the body through the urethra. In women, the urethra is short and located near the anus, which increases the risk of contamination and urinary tract infections. In men, the urethra runs through the penis and also carries semen during ejaculation. Let's look at how the kidneys work. Blood enters the kidney through the renal artery, which branches into thousands of tiny capillaries. These capillaries end in structures called glomeruli. Each glomerulus is surrounded by Bowman's capsule, and together they form what's called the renal corpuscle, the entry point to the nephron. From there, the nephron is a long series of ducts that process the filtrate and eventually lead to collecting tubules where urine is formed. So what happens inside the kidney? Blood pressure pushes plasma from the glomerulus into Bowman's capsule. This is the start of filtration. The kidneys filter about 180 liters of plasma every day, which works out to roughly 120 milliliters per minute. Most of that fluid is reabsorbed, so only a small amount becomes urine. This measurement, called glomerular filtration rate, or GFR, is an important way to track kidney health. Throughout this process, nephrons and capillaries exchange fluids and waste, and by the time the filtrate reaches the end of the nephron, what's left is urine. The kidneys do more than filter blood. They also produce important hormones. One is erythropoietin, or EPO, which stimulates red blood cell production. If the kidneys are damaged, EPO levels drop, and that can lead to anemia. Another hormone is renin, which helps regulate blood pressure. Finally, the kidneys activate calcitriol, a form of vitamin D that supports bone density. So kidney health affects not just fluid balance, but blood pressure, and bone strength. As we've been discussing, the kidneys and blood pressure have a very close relationship. If blood pressure drops too low, the kidneys respond by retaining water, which helps raise blood pressure again. On the other hand, if blood pressure is too high, it can damage the kidneys. That damage can lead to fluid retention, which makes blood pressure rise even more. This creates a dangerous, positive feedback loop. High blood pressure harms the kidneys, and kidney damage makes blood pressure worse. Let's move on to kidney stones, also called renal calculi or nephrolithiasis. These are crystals that form in the renal pelvis, and their size can vary widely. When a stone gets stuck in the ureter, it's called erythrolithiasis. In the U.S., kidney stones are most common during the summer months, June through August, because dehydration and sweating increase the risk. About 16% of men and 8% of women will experience kidney stones at some point, and certain regions are known as the stone belt because of higher prevalence. Kidney stones start as tiny crystals that form in the kidneys. Most of the time, these crystals don't cause any problems and pass unnoticed, but sometimes they collect into deposits called nidi, or it can be pronounced nidi, which can grow into larger stones. When stones become big enough, they can block urine flow, and that causes the kidney to swell and leads to severe pain, which I can certainly testify to. I've had close to 300 kidney stones in my life, so they are quite painful. Most stones pass on their own, but if they're too large, they can cause complications like infection or even kidney failure. People who have one episode or more, they're more likely to have more in the future. Risk factors include genetics, certain medications, previous surgeries, urinary tract infections, and conditions like diabetes. Kidney stones come in several types. The most common are calcium stones, which make up about 75% of cases. Struvite stones account for around 15% and are usually linked to infections. Uric acid stones, which is the kind that I had, occur when the blood is too acidic, often in people with gout, and they make up about 6%. Mine was because I was eating a lot of wild game, and there's a lot of purine in that, which can cause problems. Also, one of the reasons why I have problems with chicken. There are also rare cystine stones caused by genetic disorders and other less common types related to certain medications or metabolic issues. Knowing the type of stone helps guide treatment and prevention strategies. Because I was being treated for calcium for about a year before they realized that they were uric acid stones. Kidney stones are often silent until they grow large enough to cause problems. When symptoms appear, pain is the most common, and it usually comes on suddenly and in waves, a pattern called renal colic. The pain can be intense and may radiate toward the groin. Other symptoms include nausea and vomiting, and if the infection is present, fever and chills may occur. These episodes cause an extremely uncomfortable feeling and often lead people to seek emergency care. Treatment for kidney stones depends on their size and severity. In many cases, stones pass on their own with hydration and pain management. For larger stones, medical procedures may be necessary. These include nephrostomy, lithotripsy, or surgery to remove the stone. Medications can also help, such as alkalizing agents to dissolve certain stones, antibiotics if infection is present, and analgesics for pain relief. Lifestyle changes like increasing water intake and adjusting diet are important for prevention. I know that since I have had some of my procedures and I've changed my lifestyle, I haven't had any a few years, knock on wood, but I've had to go through many of these things here. So when it comes to massage therapy and kidney stones, timing is everything. During an acute episode when the client is in pain or waiting for treatment, massage should be delayed. After a procedure, gentle work can help with relaxation and recovery, but avoid anything vigorous. For clients with a past history of kidney stones, no special accommodations are needed as long as they're currently healthy and symptom-free. Our next condition is polycystic kidney disease, otherwise known as PKD. It is an inherited disorder where fluid-filled cysts develop in the kidneys. These cysts cause the kidneys to enlarge and lose function over time. There are two main genetic types: autosomal dominant, which is the most common and usually appears in adulthood, and autosomal recessive, which is rare and shows up at birth. There's also an acquired form that can occur in people who've been on long-term dialysis. In the U.S., about 500,000 to 600,000 people have PKD, and it accounts for roughly 5% of all cases of kidney failure. PKD begins with a genetic mutation that causes cysts to form on the nephrons. Over time, these cysts multiply, making the kidneys enlarge and lose function. About half of people with PKD will need dialysis or a transplant by the age of 60. It's not just the kidneys that are affected. Other organs like the liver, pancreas, spleen, and even the ovaries or colon can develop cysts. PKD also brings serious complications, including high blood pressure, heart rhythm problems, frequent infections, blood in the urine, and even aneurysms or stroke. Some patients also develop diverticular disease in the colon. This image shows what polycystic kidneys look like compared to healthy kidneys. Notice how the cysts enlarge the kidney and distort its normal structure. These changes explain why kidney function declines over time and why PKD can lead to serious complications. Polycystic kidney disease often causes chronic back or flank pain and abdominal bloating. Headaches are common, and the kidneys lose their ability to concentrate urine, which can lead to frequent urination. Treatment focuses on managing symptoms, controlling pain, and blood pressure is critical. In some cases, procedures like needle aspiration or embolization can reduce cyst size, and surgery may be needed for complications. For advanced PKD, dialysis or a kidney transplant becomes necessary. Medications include antihypertensives, pain relievers, and antibiotics for infection. Massage therapy for clients with polycystic kidney disease requires caution. Vigorous techniques should be avoided because cysts can rupture under pressure. Also consider the effects of medications like painkillers and antihypertensives. They can influence how the client responds to massage. Gentle work within the client's comfort level is best, and it can help reduce anxiety and even lower blood pressure. Always adapt your approach based on the client's resilience and any medical devices that they may have. Pyelonephritis is a serious kidney infection that usually starts when bacteria travel up from the bladder through the uterus to both or just one kidney. It's considered an upper urinary tract infection and can lead to severe complications if left untreated. In the United States, we see about 250,000 cases each year with over 100,000 hospitalizations. This condition is more common in women than men, and certain groups are at higher risk, such as young adult, pregnant women, and individuals with urinary tract anomalies or chronic conditions like diabetes. Pyelonephritis often begins as a urinary tract infection where bacteria, most commonly E. coli, ascend from the bladder to the kidneys. In complicated cases, structural anomalies, urethral blockage, diabetes, pregnancy, or contaminated instruments can contribute. Bacteria may also reach the kidneys through the bloodstream, making systemic infections possible. One of the ways that I got this was when I had my worst case of kidney stones, and the blockage caused this to happen. There are three main types of pyelonephritis. Acute, and that's when it appears suddenly with severe symptoms and can lead to sepsis. Chronic often results from untreated UTIs, causing slow kidney damage and scarring with minimal pain. Emphysemaceous pyelonephritis is life-threatening, involving necrosis and gas pockets, and is strongly linked to uncontrolled diabetes. Acute cases typically present with fever, chills, painful urination, cloudy or bloody urine, back pain, nausea, and fatigue. In elderly patients, cognitive decline may be a key indicator. Chronic cases are often subtle or asymptomatic, but lead to cumulative kidney damage over time. Treatment focuses on preventing progression from a UTI to pyelonephritis. Antibiotics are the primary intervention, and monitoring is essential for at-risk populations such as pregnant women or those with chronic conditions. For acute cases, massage should be avoided until the infection has fully resolved. In chronic cases, gentle massage may be appropriate, but rigorous techniques should be avoided due to compromised kidney function. Massage can help reduce stress and anxiety, and fully recovered clients can enjoy standard massage benefits. Always watch for signs of overtreatment such as headache, bloating, or hypertension. Now we're moving on to renal cancer, and this refers to cancer that originates in kidney tissue, with most cases being renal cell carcinoma or RCC. In the United States, there are about 63,000 new diagnoses each year and roughly 15,000 deaths. Men are affected twice as often as women, and the average age at diagnosis is 64. Currently, about 200,000 people in the U.S. are living with a history of renal cancer. The kidneys are primarily made up of epithelial tissue, which is vulnerable to mutations. Renal cell carcinoma usually begins in the renal cortex and can invade surrounding fat, fascia, the renal vein, adrenal glands, and even the vena cava. These tumors are highly vascularized, making metastasis easier. Risk factors include genetic conditions like von Hippel-Lindau syndrome, smoking, obesity, hypertension, long-term dialysis, certain medications, and exposure to toxins. There are three main types of renal cancer. Renal cell carcinoma accounts for about 90% of cases and includes multiple subtypes that influence treatment. Transitional cell carcinoma starts in the renal pelvis and behaves similarly to bladder cancer. Wilms tumor is rare and mostly affects children between the ages of 2 and 6, but it has a good prognosis if detected early. Renal cell carcinoma often produces no symptoms until it's advanced. When symptoms do appear, they may include blood in the urine, a mass in the abdomen, flank pain, unintended weight loss, fever, fatigue, and malaise. These signs can resemble polycystic kidney disease, urinary tract infections, or pyelonephritis, which makes early detection very challenging. Treatment for renal cancer is aggressive. Surgery is the primary approach, often involving removal of the kidney and sometimes surrounding tissue. Other options include arterial embolization, radiation, radiofrequency ablation, chemotherapy, and biologic therapy. Medications may include chemotherapy agents, biologics, and angiogenesis inhibitors to slow tumor growth. Massage therapy for clients with renal cancer require advanced training because of cancer-related complications and treatment side effects like skin damage, hair loss, and fatigue. Skilled massage can help reduce pain and anxiety and improve sleep, mood, and overall quality of life. Sessions should be adapted based on the client's stage of cancer, treatment plan, and resilience. So let's move to renal failure, and this occurs when the kidneys can no longer maintain normal function. There are two main types: acute renal failure, which is a sudden drop in function over hours or days and is often reversible, and chronic renal failure, which develops gradually over months or years and is usually permanent. Kidney disease affects about 30 million adults in the U.S., and it's often undiagnosed in its early stages. Higher risk groups include men, older adults, African Americans, who are 4 times more likely than whites, Native Americans, and Hispanics. Around 662,000 people are on dialysis or living with a transplant, and about 100,000 are on the transplant list. Kidney disease is the 9th leading cause of death. Renal failure means the loss of key kidney functions, including fluid and electrolyte balance, production of hormones like EPO and renin, and the ability to concentrate urine. This leads to complications such as anemia, edema, pericarditis, electrolyte imbalances, bone density loss, and arrhythmias. Chronic damage often results from hypertension and diabetes, causing scarring over time. Risk factors for renal failure include age, diabetes, hypertension, cardiovascular disease, obesity, high cholesterol, lupus, family history of kidney disease, polycystic kidney disease, glomerulonephritis, and exposure to toxins. Diving into acute renal failure a little bit more, it falls into 3 categories: prerenal problems, occur when blood flow into the kidney drops. Intrinsic problems happen when the kidney itself, such as infections. Postrenal problems occur when fluid is prevented from leaving the kidneys, often due to obstruction. Chronic renal failure, also called chronic kidney disease, can last for months or years before symptoms appear. It's tracked using the glomerular filtration rate, or GFR. A normal GFR is about 120 milliliters per minute, while stage 4 or end-stage renal failure is 15 milliliters per minute. Symptoms of renal failure can affect nearly every system in the body. They include decreased urine output, systemic and pulmonary edema, arrhythmia, anemia, osteomalacia, skin rashes and discoloration, fatigue, headache, peripheral neuropathy, tremors, seizures, bruising, bleeding, muscle cramps, and changes in mental or emotional state. Treatment for acute renal failure focus on restoring blood flow to the kidneys quickly. For chronic renal failure, the goal is to control symptoms and slow progression. This includes managing blood pressure and glucose, using medications for electrolyte balance, avoiding NSAIDs, and considering dialysis or even possibly transplant if needed. Medications may include antihypertensives, diuretics, phosphate and potassium lowering drugs, EPO stimulants, or iron supplements. For clients with significant renal impairment, avoid vigorous massage because fluid management is compromised. Dialysis patients have an increased infection risk at the access site, and transplant patients face infection due to immune suppressant drugs. Gentle massage with the client's adaptive capacity can help with pain, anxiety, and quality of life. Avoid techniques that emphasize fluid movement, like lymphatic. Massage may also reduce itching, leg cramps, and improve well-being for dialysis patients. Bladder cancer is a malignant growth in the bladder, most often involving transitional cells, and it's the sixth most common cancer in the U.S., with about 79,000 diagnoses and 17,000 deaths each year. Men are affected more than women at a ratio of about 3 to 1, and the median age at diagnosis is approximately 65. It's most frequent among white individuals and smokers. Bladder cancer originates in the epithelial lining of the bladder, and toxins in urine can damage these cells, leading to rapid replication and genetic disruption. Causes include pelvic radiation, chronic infections, bladder stones, catheters, certain chemotherapy drugs, and even parasitic infections. Smoking accounts for about half of the U.S. cases, and other industrial chemicals are also implicated. While bladder cancer is usually detected early, its reoccurrence rate is high at around 80%. There are two main tumor types. Papillary tumors are wart-like and attached to a stalk, making them less invasive, and non-papillary tumors are embedded in the bladder wall and tend to be way more aggressive. The most common type of bladder cancer is transitional cell carcinoma, which accounts for about 90% of cases and can affect the bladder, the urethra, ureters, and kidneys. Squamous cell carcinoma makes up about 5% of cases in the U.S. and is more common in developing countries, often linked to schistosoma infection. Other rare types include small cell carcinoma and adenocarcinoma, which together account for about 2% of cases. Early signs include painless blood in the urine, which may appear red or rust-colored. Later symptoms can include bladder irritability and compression on the rectum or other pelvic tissues. Treatment depends on the stage of the cancer. Surgery may involve removing the bladder, prostate in men, or uterus and ovaries in women, along with pelvic lymph nodes, which can increase the risk of lymphedema. Other options include radiation, chemotherapy, and biologic therapy, sometimes delivered directly into the bladder. Medications include chemotherapeutic agents and biologics. Massage therapy for bladder cancer clients requires advanced training because of cancer related complications. So, we've talked about that plenty of times, and there will be later discussions about that in a couple chapters. But there's often side effects such as skin damage, fatigue, and medical devices like stomas or catheters. So, skilled massage can help reduce pain and anxiety and improve quality of life. And just remember to cover your positioning because of medical devices. Painful bladder syndrome, or PBS, is a chronic pain condition centered on the bladder and urethra. It overlaps with interstitial cystitis, but is not identical. PBS primarily affects women, and though men and children can also be affected, in the U.S., estimates suggest 3 to 8 million women and 1 to 4 million men experience this condition. It's often linked to chronic pelvic pain syndromes. A healthy bladder stretches to hold about 8 to 12 ounces of urine, and normal urination occurs 6 to 8 times a day. In PBS, pain occurs with bladder filling or emptying. Even though there's no infection, stones, or obstruction, the cause is likely multifactorial and may involve muscle hypersensitivity, trigger points, and central sensitization. PBS often coexists with conditions like fibromyalgia, irritable bowel syndrome, and chronic fatigue syndrome. Symptoms include chronic pelvic pain, pain during urination, burning, frequency, urgency, and painful intercourse. Pain is often worse when the bladder is full and may be exacerbated during menstruation. The condition can run in cycles of flare and remission, and severity varies from person to person. Treatment focuses on symptom relief and coping strategies. Lifestyle changes such as exercise, smoking cessation, and dietary adjustments can help. Therapies may include psychotherapy and physical or occupational therapy. Medications range from pentosan sulfate, which helps repair the bladder lining, to DMSO installations, analgesics, antidepressants, and anti-seizure drugs. In severe cases, surgical options may be considered. Massage therapy for PBS should be gentle and within the client's comfort level to avoid exacerbating pelvic pain. Clients may need bathroom breaks during sessions, so consider keeping a wraparound robe in your room so that they can quickly put it on if they need to go to the restroom. Skilled abdominal work can be helpful if welcomed. Positive, non-alarmist communication is essential. Adjust for external urine reservoirs or medical devices. Myofascial manual therapy, often provided by physical therapists, may help, but trigger point work in the perineum is outside the scope of massage therapy. And our last condition that we will be covering as part of the urinary system conditions is urinary tract infection, or UTI. It is an infection of the bladder called cystitis or the urethra, known as urethritis. About 50% of women experience at least one UTI in their lifetime, most commonly between ages 20 and 40. UTIs account for roughly 8 million doctor visits annually. In men, UTIs are less common and may indicate underlying issues such as prostate problems or sexually transmitted infections. Normally, the bladder is sterile and lined with protective mucus. UTIs occur when microorganisms enter the urinary tract, with E. coli responsible for about 90% of cases. Risk factors include the short female urethra, catheter use, chronic irritation, and immune differences. Additional factors include spermicide or diaphragm use, pregnancy, menopause, diabetes, and neurogenic bladder. If untreated, UTIs can lead to serious complications, including pyelonephritis, renal failure, and even sepsis. Prevention strategies include drinking plenty of water and acidic juices, urinating frequently, and wiping from front to back after bowel movements. Showers are preferable to baths, and it's important to empty the bladder after sex. Avoid feminine hygiene sprays and douches as they can increase irritation and infection risk. Common symptoms include painful burning and frequent urination, cloudy or blood-tinged urine, and pelvic, abdominal, or back pain. In men, UTIs may also cause pain in the penis or scrotum. Treatment involves drinking plenty of fluids and consuming blueberries or cranberries without added sugar. Antibiotics are the primary intervention, and it's crucial to complete the full prescription to reduce the risk of chronic infection and kidney damage. Painkillers may help with discomfort, and chronic cases may require long-term antibiotics. During an active infection, avoid challenging massage techniques as clients may be uncomfortable lying down. Gentle work is acceptable during infection, and no special accommodations are needed for clients with a past history of UTIs. In summary, the urinary system plays a vital role in maintaining fluid balance, filtering waste, and supporting overall health. Conditions like kidney stones, polycystic kidney disease, pyelonephritis, renal cancer, renal failure, bladder cancer, painful bladder syndrome, and urinary tract infections can significantly impact quality of life and require careful management. As massage therapists and health professionals, understanding these conditions helps us provide safe, effective care and adapt our techniques to support client comfort and well-being. Always prioritize communication. Respect medical guidelines and work within your scope of practice to ensure the best outcome for clients.